The New York Times had to sue the Centers for Disease Control under the Freedom of Information Act to obtain data on the demographic impact of the coronavirus, which allowed the Times then to publish its lead story on page one today. Having studied the data, the New York Times reports Latino and African-American residents of the United States have been 3 times as likely to become infected as their white neighbors. Black and Latino people have been nearly twice as likely to die from the virus as white people. Of Latino people who died, more than a quarter were younger than 60. Among white people who died, only 6% were that young. Experts point to circumstances that have made Black and Latino people more likely than white people to be exposed to the virus. Many of them have frontline jobs that keep them from working at home, rely on public transportation, or live in cramped apartments or multi-generational homes. Joining our discussion now is Julian Castro, the former Secretary of Housing and Urban Development in the Obama administration. He is a former mayor of San Antonio, Texas. Thank you very much for joining us tonight. I want to get your reaction to this reporting in the New York Times today.
Well, it's a blockbuster report. Eye-opening, I think, for a lot of people. It's, what can you say? It's appalling. It's tragic. It's infuriating. It's also, Lawrence, for folks who are still wondering why so many people are out there on the streets or have been out there over the last 6 weeks protesting inequality in this country, this is a perfect example of what people are talking about. We know that this is the result of so much inequality, systemic racism and inequality in housing, life and death in these communities. On top of that, as you showed there, one of the biggest ironies here is that the community that have suffered the most have also been asked to do the most. They have been the ones going and working in the fields as farm workers, working in these meat packing plants that have outbreaks of coronavirus. They're fast food workers who are working for low wages and bad benefits, grocery store workers. And so all around, it is a prime example of the inequities that continue to haunt this nation. And the important question now is, what are we going to do about it? What are we going to do about it? Not just the public health aspect, but beyond this time period, the next few weeks, what are we going to do about this?
I want to go to some of the facts that the Times uncovered to specify just how difficult this is in these communities, especially the difficulty in working at home, which is next to impossible. It says across the country, 43% of Black and Latino workers are employed in service or production jobs that, for the most part, cannot be done remotely. Census data from 2018 shows only about 1 in 4 white workers held such jobs. And so they're the numbers right there on the safest thing you can do, which is stay at home. That's just not available to at least half of these workers.
That's right. I mean, that is a stunning statistic, but it relates to the plight of so many families out there, disproportionately Black and Latino, that don't have the option. They don't have the option of staying home. They need to go to work if they're going to get a paycheck. They work in these industries that actually require them to be on site. And that's why I think that we need to do things like pass the HEROES Act, offer direct rental assistance to people so that they can hold on to their housing. We need to do more in a robust way to provide a stronger safety net during this coronavirus time period and going forward. It's also, I think, a great demonstration of why we need universal health care. We need to ensure that we close that digital divide. We need to ensure that we raise the minimum wage and provide good benefits for people.